metabolic syndrome and syndrome X are often in there. Are those all the same thing?
They're not all the same, but we do see a lot of interrelatedness between the two. So the metabolic syndrome is a syndrome, when we think about syndromes, we think about usually it's a constellation of risk factors.
Although
the American College of Cardiology, American Heart Association classification for heart failure classified heart failure into 4 stages, A being the risk factors for heart failure, B being the asymptomatic heart failure,
syndrome and syndrome X are often in there. Are those all the same thing? They're not all the same, but we do see a lot of interrelatedness between the two. So the metabolic syndrome is a syndrome, when we think of
motion. Exercise every day. Just a half hour of walking can make a huge difference. Lose weight if you need to. Your waistline should be
association between mutations and the syndrome.
less than 35 inches for a woman and less than 40 inches for a man. Work with your doctor.
Gene mutations with alleged effects can occasionally produce features of this syndrome. The advent of next-generation sequencing has provided an unprecedented opportunity for the identification of rare variants with moderate to large effects. Association between mutations and the syndrome. One application of this technique is identification of rare mutations that account for extreme phenotypes in outlier population. In such a population, the possibility of identifying founder mutation that segregate with extreme phenotypes is dramatically increased. Effect of DYRK1B, R10-2C, and adipokine transformation. These mutations belong to
of abnormalities that tend to occur in the same people, and by definition definition, the metabolic syndrome means that you have 3 of the following 5 abnormalities.
The first abnormality is high blood pressure or hypertension. A blood pressure greater than or equal to 130 over 85 millimeters of mercury meets the criteria for hypertension.
The next one is an abnormal level of blood glucose. This may or may not be associated with diabetes, depending on how high the blood sugar is. But this would include a blood sugar that in the fasting state is greater than 100 milligrams per deciliter. And a lot of people do have what we call prediabetes, so not a high enough level to be called diabetic.
B being the asymptomatic heart failure.
DYRK1B, the expression of DYRK1B increased dramatically during adipogenic differentiation. Adipogenesis is a process of maturation of their undifferentiated mesenchymal stem cells toward the adipocyte lineage.